Hi, and welcome to the Hale Clinic. My name is Dr. Georgina Hale. I'm a certified practitioner in functional medicine, but this has been on a background of my medical degree. I have a specialist degree. I'm in infectious diseases and general medicine, and I've also got a clinical PhD in women's health. I want to introduce my colleague here, Dr. Paula Rodriguez.
Hello, I am Dr. Paula Rodriguez. I am a doctor of psychology and my background, I have 20 years experience working as a privately practicing psychologist and recently made a transition after some different life experiences that I've had, made a transition over into functional medicine because I felt that was offered a lot to assist a lot of the patients that I was working with to change their life in a real and meaningful way.
So this is actually the first of many educational videos that we want to do for the clinic, and it serves a couple of roles in that it serves to educate people who can't make it to the clinic and can't come here for an appointment and a personalised assessment, but it also helps us research, look at the research and bring the latest research findings to you in functional medicine. So we practice here IFM, or Institute of Functional Medicine, kind of functional medicine. It's a specific functional medicine that has attached to it a structure of assessment. It's really well suited to what I see as mainstream medicine, which is what I specialise in, but it actually allows me to draw from the new research into the pathophysiology or the underlying causes of disease. So we actually have the knowledge of how cells dysfunction and how organs start to dysfunction prior to disease. And so we're really working at the ground root level, it's in causation medicine. And we can also combine it with mainstream medicine as well. So we look forward to bringing you more, and we hope you find our subjects interesting. And I'm just going to ask my colleague again what Paula sees as her role in functional medicine as a psychologist.
Well, what I've found with my functional medicine training is that for many years I focused on psychology in isolation, so looking at what was happening for the person from the point of view of psychological issues. And what I came to realise with functional medicine is that we can't actually do that. We can't look at one issue in isolation. We can't look at health as a separate issue to mental health. We need to look at the person in their entirety and all of their needs. And when we do that, we get much better client outcomes with that type of practice. And functional medicine offers that. Psychology fits perfectly into that. And it's been a great transition.
You wanted to ask me a question.
I did want to ask you a question. And what do you see as the psychologist's role in functional medicine?
Well, I reckon I see as Paula coming to join the team is really an important part of the next transition for the Hale Clinic. I mean, I've been solo practicing and really learning a lot of the new science, and I can make quite, in-depth diagnoses, and I have a long list of issues that I can address in many patients who might look normal on the mainstream testing, but I have an awful lot of things I can tell the patient that they can address. Then it's about addressing the eating plans, the lifestyle, and the sleep patterns. It's all about trying to make changes, and I have found that the thing where most of my patients do slip up is being able to change patterns from before. Many people who are very sick find it easy to do, but they are particularly patients that need support in their program, and they need to know that we're behind them, we're following them, and we're really supporting them through sometimes very difficult phases. So I'm really looking forward to having Paula join the team. And there's a third person to our party who's not with us today, and that's Dr. Shelley Kabatsa. She's an IFM or AFMCP trained nutritionist, and we hope to have her on the next video. And so that's it from us today. From me, Dr. Georgina Hale,
and me, Dr. Paula Rodriguez.
See you next time.
See you next time.